So go ahead, your question is?
I have a lot of clients with acne and active acne. I know you talked a little bit about acne at the beginning. Can you just kind of go over again what I should do with my clients that have acne?
Sure. If you have someone that comes in that has active acne, and when we talk about active acne, we talk about red pustules that actually have a true whitehead on it. What you can actually do is you can opt to do an acne facial first, which is just cleaning up the skin, prepping it and preparing it. And then what you can do is you can use the microderm on that particular person. However, if there's an acne lesion here, you want to go around it. You don't want to go over it. You can spread bacteria, okay? At the end of your microderm treatment, when you are completely done scrubbing down the skin, you're going to be able to see the areas that you have avoided, where you've had the active acne lesion. At that point, it is at your discretion if you choose to extract that or not. Hehowever, this is not something that we recommend to use as an extractor itself. Because as you know, it removes blackheads and milia and congested pores, but this is not something that you want to run over a large acne pimple. That would not be good. You would spread bacteria that way.
Is there any time that you could go over acne?
The only time you can really go over acne is if someone comes in and you can tell that they've had a little bit of a breakout here or there, and they've actually got, say, a scab that was left behind from the acne itself, or is a pigmented area that was left there from an acne pimple. Sure, go over it. That's easy. That's really easy. I mean, it would be more beneficial for them to come and see you and have you do that instead of them trying to put on more product to try and mask it. So if you have someone that comes in, and even if they have a couple ones that are active and some of them that are healing, go over the ones that are healed, that are flat to the skin, that don't look angry and don't look like they have a big white head on them. That's perfectly fine to do. Yes?
Do you have men clientele, and is the procedure any different for men as it is for women?
What I usually like to do for men is I will try and tell them, please shave before you come in. Some people find that very tricky. Most of my male clientele, they usually come in towards the end of the day, where they have a slight shadow, not a real shadow, but just a slight shadow, and that's perfectly fine. Men respond very well to this, and it's easy for men to do. It's a non-threatening procedure. It's not a chemical peel. It's not like they're going to leave the office and someone's going to say, oh my gosh, what did you just have done? It's very easy to do, and it will give them the results that they want.
How long do the results last?
Very good question, and a lot of people ask that. Like I touched on before, I have some people that come in once a month, and they see me once a month, and they've been seeing me once a month for years, which is great. And the results look really, really good. Usually when I start off with a primary client, I ask them, please commit to me at least 6 to 10 treatments, at least every 7 to 10 days apart. At the end of that series, you've got great results, your skin is fantastically better than what it was before, and it is up to you as the esthetician to reiterate to your client, I need you to be on these products. The only way you're going to keep your results is if you avoid direct sunlight, make sure you wear a sunscreen, and make sure that you are using products that are going to keep the cellular turnover going. I also encourage people to do a maintenance program. And a maintenance program to me, and what I try and reiterate to my clients is, once a month or once every 8 weeks, come in for a pretty aggressive treatment. So when I talk about pretty aggressive treatment, I mean turn the dial, start them at maybe about a 5. If someone comes in for their maintenance treatment, they've gone through their series, they've gone through the 10th one, they're happy, they're ecstatic, and they say, how am I going to keep this? Keep them on their products, tell them to wear their sunscreen on a regular basis, and say, you know what, I'm going to see you in about 6 to 8 weeks, and we're going to do a real aggressive treatment on you. And you want to start the intensity, instead of at a 4, you want to start your gauge intensity at least a 5, 5.2, 5.3. It's going to be slightly uncomfortable for the client, but that is their maintenance. That's going to get the cellular turnover turning really quickly again. Now the only downfall would be is that instead of being pink for about maybe 15 to 20 minutes. They might be pink for, you know, an hour, 2 hours or so, and they're going to be a little bit more sensitive, and they are going to feel a little bit more stimulated, which is perfectly fine, and most people are okay with that. So when we talk about results, it is up to you, once again, as the esthetician, to get the point across to your clients. I need to see you on a maintenance program, and I also need to see you on your products. And that's how you will maintain the results that you're going to get. I've had numerous people that have gone through 10 treatments, their skin looks great, I've got everything on photography, their before and afters and in-betweens, and then they come back 2 months later and they run white. And they do more sunscreen. It's like, great, okay, well, you're not as bad as you were before, but you might have to start back up again. And then there are some people that might need more than 10 treatments. It depends on what their chief complaint is. I find some people that come in that have a lot of melasma or hyperpigmentation. I know for a fact it's going to take a little bit longer. And I also know for a fact, and I tell them right off the bat, we're going to go a little bit more aggressively to really get in there and just start peeling away the layers of that stuff. So it really, the patient will dictate, their skin will dictate what kind of treatment they're going to need, what their maintenance program is going to be, and how long the results are going to last. Yes?
If somebody's had laser surgery recently or other skin, they've been on skin treatment or anything, should I treat them or should I get a doctor's note or should I?
I tend to err on the side of conservative. Being that also work with multiple different plastic surgeons and dermatologists, if someone comes in and they have just had a very large laser peel, they are going to be in recovery for quite some time. I would not recommend doing that. If someone just came in and said, oh, I had a TCA peel done or I had a medical grade peel done by my doctor, and you notice that they've got some dehydrated spots or they've got some flakiness that's coming off, definitely do this. They will love this probably better than what they do with the chemical peel because it will really help to smooth out their skin for them. A trend nowadays is doing light laser treatments. You still get some peeling from it. You can have them do their laser peel treatment and then they can come back and see you in about 7 days. And once again, they'll probably like this better than they did the laser peel because this is immediate gratification. Your skin feels better, it looks better, it's immediate. As to where the other treatments that are out there, it takes some time until you really start to see things build up and see the results. But that's a very good question. This training video that we have done for you is to guide you through the Microderm machine and how the products are used in conjunction with it. If for some reason you feel that you have any other questions after reviewing the training video, please feel free to call the toll-free number and any one of the staff can help you there. But we do hope that this has walked you through the whole entire process and you find it very successful in your practice. So thank you very much. This training video that we have done for you is to guide you through the Microderm machine and how the products are used in conjunction with it. If for some reason you feel that you have any other questions after reviewing the training video, please feel free to call the toll-free number and any one of the staff can help you there. But we do hope that this has walked you through the whole entire process and you find it very successful in your practice. So thank you very much.